welcoming all of you to this session, and so we are opening the screening round first. Thank you, all of you.
Okay, now starting with the first question. It was following are the predisposition to Alzheimer's disease except Down syndrome, head trauma, smoking, low education group. Anyone in audience would like to answer this question? Okay, sir. So the answer is smoking. Uh, in fact, there are some hypotheses which say that smoking is a protective factor for Alzheimer's disease. So the answer was smoking. Coming to the next question, dementia is produced by the deficiency of which vitamin? Vitamin A, D, pyridoxine, niacin. So the answer was niacin. The third question, confabulation means the answer to this is making stories to fill up gaps in memory loss. This is commonly seen in alcoholics. All are true about hyperactive child except poor impulse control, which is seen, increase in anger outbursts, this is also seen, decrease in attention span, this is very common, so answer is C, right to left disorientation. The next question was, which one of the mature defense mechanism, which of the following is the mature defense mechanism? So the answer is altruism, it is a mature defense mechanism and others are immature. So what is altruism? It is an act of goodwill towards another person, knowing as altruistic behavior can be used as a way of diffusing a potential anxious situation. What is repression? It is excluding a painful or avoiding anxiety thoughts and it is involuntary. Regression is going back to the previous developmental state and denial as usual, it is complete denial of what is happening. The sixth question is, fugue state may be seen in schizophrenia, hysteria, epilepsy or all of the above. The answer is all of the above. Although it is a very rare psychiatric phenomena which is characterized by reversible amnesia for one identity in conjunction with unexpected wandering or traveling. In this situation, patient may also take up a new identity and the inability to recall personal information prior to the presentation of symptom is also present. Next question. A person who is chronic alcoholic is brought to casualty. When asked, he says that he is drinking because of the quarrel with his wife. So which of the following defense mechanism is he using? Is it denial, rationalization, sublimation or projection? It is rationalization. So what is rationalization? It is basically making excuses, convincing oneself that whatever he is doing that is not wrong or was alright through faulty and false reasoning. Coming to the other option, what is denial? It is failure to acknowledge an unbearable condition. Sublimation is unaccepted drives are unconsciously channeled into socially accepted modes of expression. Projection is a defense mechanism in which individual recognizes their unexpected traits or impulses in someone else to avoid recognizing those traits or impulse in themselves subconsciously. Which of the following center is for recent memory? The options were parietal cortex, temporal lobe, hippocampus, thalamus and subthalamus, and the answer was hippocampus. Irresistible urge to move about and increase motor activity is known as which of the following? So the answer was akathisia. This was a very interesting question, which is the most specific to psychosis. Either it is delusion, neologism, incoherence or perseveration. So the answer was neologism. See, we see delusion in other disorders also, like in depression also we find some kind of delusion. Incoherence and derailment is also seen in organic mental disorder, and perseveration is very commonly seen in organic. But neologism is very specific to psychosis. Coming to the next question, which was Oedipus complex, which is given by Sigmund Freud, is seen in which age group? Either 1 to 3 years of age in boys, or 6 to 12 years of age in boys, 3 to 5 years of age in boys, or in girls from 13 to 18 years. The answer is 3 to 5 years of age. So this is a psychoanalytic theory given by Sigmund Freud. It is the third stage of the developmental stage, which is the phallic stage. It comes under 3 to 6 years of age, and the main focus is in the genital part of the body. So in this Oedipus complex, the son develops a sexual attitude toward his mother, and there is fear of castration, which he feels from his father. So the age group in this is 3 to 6 years. The next question was, an alcoholic woman was brought to the casualty following a suicide attempt by taking several tablets of diazepam. There is a history of previous attempt of suicide by wrist slashing, etc. The type of personality disorder in this woman is histrionic personality, dependent personality, narcissist, or borderline. The answer was borderline, as it is very common in borderline that there are suicide attempts, there is abuse to the substance. So the answer was borderline personality. The next question, 8-stage classification of human life is proposed by whom? So the answer is Erikson. Erikson has given the psychosocial stages of development. There are 8 stages. The first stage is infancy, which is from 0 to 1 year. Second stage is early childhood, 1 to 3 years. Then play age, 3 to 6 years. School age, 7 to 11 years. Adolescent, 12 to 18 years. Early adulthood, 19 to 29 years. Middle age, 30 to 64 years. And old age, which is 65 onwards. Next question, Mr. X, a 24-year-old alcoholic, has got a change in his behavior. He has become suspicious that people are trying to conspire against him though his father states that there is no reason for his fear. He is getting hallucination of voice commenting on his action. What is the most probable diagnosis? So the answer is schizophrenia, as this is directly fulfilling the major criteria, which is commenting type voices. The question number 15th was ego's defense mechanism undoing is typically seen in which of the following disorder? The options were depression, schizophrenia, obsessive compulsive neurosis, hysteria. Answer is C, that is obsessive compulsive neurosis. Undoing in OCD is a type of compulsion that involves trying to erase or cancel out a distressing thought or feeling by performing a mental or physical action. Some people with OCD call it starting over, resetting, or undoing. The purpose of undoing is to return to a clean mental slate, but it often reinforces the obsession and increase the anxiety. Coming to the next question, that part of the mind which is working on reality principle is either it's id, ego, superego, or ego-idol. The answer is B, ego. As we all know, there are 3 types, id, ego, and superego. Id is derived from the pleasure principle. It basically is I want it right now. Ego is reality principle. It plans and wait in order to have it. And superego is morality principle. You can't have it right now. So in which of the following reinforcement is used? Psychoanalysis, hypnoanalysis, app reaction, conditioned learning. So it is used in conditioned learning. Next question is dementia is seen in all except schizophrenia, head injury, Huntington chorea, and cannabis. So dementia is not seen in Huntington chorea. In other diseases it is fine. Question number 19. A 43-year-old father of 3 believes his wife is having an affair. He has been examining her laundry and trying to access her email account. There is no basis in reality to his belief and he has no proof to support it. However, he is adamant that he is correct. His wife has tried to reassure him, but she feels that this is making it worse. What is the man's diagnosis? Option were delusion of love, morbid jealousy, sexual envy disorder, delusion of control, erotomania. So the answer is morbid jealousy. In this delusion of love and erotomania are same. In this there is a delusion that someone in higher position is in love with them. Sexual envy is basically in context to penis LV, which is seen in Electra complex, which is described in Sigmund Freud's phallic stage of development. It is the counterpart of the Oedipus complex. Question number 20 was, a 65-year-old woman tells you at the outpatient clinic that her husband has been replaced by a double. This person looks the same as her husband and shares the same mannerism as him, but in her view is certainly not her husband. How would you describe her belief? It's either folie deux, delusional infidelity, delusional interpretation, Capgras syndrome, or delusional memory. So the answer is Capgras syndrome, in which the patient feels that his close one or a close family member has been replaced by someone identical. Question number 21 was, a 57-year-old man believes the electricity company is persecuting him by sending error message on website and by making the light flickers on and off at night. As there is no evidence, his wife initially does not believe him, but over the time comes to share the belief. What is this phenomena called? This is basically shared delusion, which is also known as folie deux. The question number 20, in this there were 3 parts. So we have to choose the treatment of choice for all the 3 situations. The options were, first option was stop clozapine, start hyoscine hydrochromide, reduce clozapine, add antidepressant, start depot medication, increase clozapine, admit to hospital, or add amisulpride. So the first scenario was a 3-year-old woman treated with clozapine in the community presents reporting reduced energy over the past month. She reports feeling low, has loss of interest in day-to-day activities, is sleeping poorly, and reports poor concentration. So in this scenario, the option was D, in which we should add an antidepressant, as there is clearly the symptoms of depression. Part 2, a 28-year-old man is being titrated with clozapine. He complains that his pillow is soaking wet when he wakes in the morning. So in this scenario, we should start hyoscine hydrochromide, and the answer was option B. The third scenario, a 30-year-old man has been treated with clozapine for 6 months. He reports that he stopped smoking cigarettes 2 weeks ago. Today he seems sedated and reports that he has been constipated over the past weeks. In this case, we should reduce clozapine, as we know that smoking cigarettes has an interaction with many medication including clozapine. So as soon as he stopped cigarettes, there was a side effect which is commonly seen in clozapine has started to come on the surface. So we should reduce the clozapine. Question number 23 has the similar outlet, in which there were 3 scenarios and treatment choices were given to you and you had to choose one. The first choice of treatment was quetiapine, then depot medication, ECT, lamotrigine, clozapine, antidepressant medication, hospital admission, and lithium carbonate. So coming to the first situation of this part, a 26-year-old woman with the diagnosis of schizophrenia is admitted to hospital following a relapse of psychosis. This is her 3rd hospitalization in the past year, and all occurred secondary to the non-adherence to the oral antipsychotic medication. She had previously responded to oral antipsychotic medication when adherent. So in this situation, the answer is we should shift to depot medication for better adherence. Second situation, a 34-year-old man with diagnosis of schizophrenia presents to OPD reporting command hallucination and suicidal thought. In this situation, the option is hospital admission, as there is an indication in the admission when there is harm to self or others, we should admit the patient. So he was having a suicidal thought and command hallucination. So the option is hospital admission. The third scenario, a 28-year-old man with a history of schizophrenia present to clinic with ongoing psychotic symptoms, having failed to respond to 3 different antipsychotic treatment. So in this case, start clozapine, as the patient has become resistant schizophrenia, and the option of treatment is to start clozapine after 3 trials of different antipsychotics. Coming to question number 24. Professionalism and ethics option. The first scenario, a medical student presents a hospital case at a conference without obtaining a patient's consent. Second scenario, a psychiatrist informs a colleague that a patient of his has threatened to harm them. Okay. So in this all scenarios, we have to identify which of the following are inappropriate breaking of confidentiality. So this was the option A and B. And the second part was appropriate breaking of confidentiality. Okay. Appropriate breaking of confidentiality, there are 3 scenarios. The first one, a psychiatrist informs a colleague that a patient of his has threatened to harm them. In this kind of situation, we should always inform where there is anyone going to be harmed. Second scenario in which confidentiality breaking is appropriate is a woman reports thought of self-harm to medical student, who then report it to the psychiatrist. And the third appropriate situation of breaking the confidentiality was a severely depressed patient informs the psychiatrist that he wishes to kill his wife. The psychiatrist then informs the patient's wife of this threat. In of confidentiality. Question number 25. A 37-year-old woman with a long-term history of depressive illness is referred to a psychologist for psychotherapy. The therapist encouraged her to gain an understanding of the effect of her unconscious feeling on her relationship with her family. She also encourages her to make a connection between her past and present relationship. What type of therapy is being used? So this is a psychodynamic psychotherapy. Coming to question number 26, a 21-year-old man becomes extremely distressed when his advances towards a woman in his university class are rejected. He feels it is very unfair that his feelings are not reciprocated as he cares deeply about her. He says that he has always happened to him and that he has no hope of finding love in his life. He downplays the fact that 2 other women have expressed an interest in him. He believes that someone at his age should have a girlfriend. How would you categorize his thought in psychological terms? Either immature thinking, extroversion, acting out, cognitive distortion, intellectualization. So this is cognitive distortion. Aaron Beck has postulated a cognitive triad of depression that consists of view about self, a negative self-percept, about the environment, a tendency to experience the world of hostile and demanding, and the future, the expectation of suffering and failure. Targeting this distortion is central component of cognitive behavioral therapy. Question number 27. Gastrointestinal upset is commonly early side effect when using SSRI. Which mechanism of receptor action is the most responsible for this effect? So it is 5-HT3 stimulation. Question number 28. The treatment options, start aripiprazole, start metformin, diet and exercise, start atorvastatin, stop clozapine, start depot medication, start antidepressant medication, and start methylphenidate. Situations where a 30-year-old man with a diagnosis of schizophrenia has remained stable while treated with olanzapine for past 5 years. At his 5 months physical health checkup, he presented with 2 consecutive fasting serum glucose level, that was 7.5 millimole per liter, and HB1AC 6.9. So the option which should be done is start metformin and diet and exercise plan. As he was on olanzapine, he started to have the metabolic syndrome. The second scenario, a 32-year-old woman has been treated for the past 3 months with clozapine. She presented with weight gain. She has recently completed a diet and exercise program but without any improvement in her weight. So what is the next option? Start aripiprazole and start metformin. So always when there is a weight gain problem or any metabolic syndrome, the first step is diet and exercise. As this patient has already done that, so we have to shift her to medications. The third scenario, a 36-year-old woman with schizophrenia has been stable while treated with clozapine for the past 10 years. At her 6-month physical health checkup, she has elevated serum cholesterol at 6.7 millimole and elevated low-density lipoprotein cholesterol at 4.1 millimole. This is the second occasion that she had a similar abnormal blood result. So the treatment option for her is first is diet and exercise plan and then start atorvastatin. So there were 28 questions with different subtypes. This is the end of the screening test. So the results is out. Sir, marks disclosed? Okay. So with highest mark is Dr. Surpi. You are qualified for the second round. Second is Shamashish, 38 points. And in the third, there is tie actually. Dr. Avnish, 30 marks, and Dr. Ria, 30 marks. Well done, Dr. Kamlesh, but you won't be joining us for the second round. These are the four participants for the second round.
In this second round, we have 4 participants, and rank-wise, they are Dr. Surbi, the candidate A, Dr. Shyamasi's candidate B, Dr. Kamlesh, candidate C, and Dr. Ria, candidate D. The rules will be as follows. Okay, Dr. Avnish, third. Yes. So I am correcting myself. Dr. Avnish is third, and Dr. Ria is candidate D. So firstly, we will discuss about the rules of this round. There are total 12 questions, and 10 seconds are given to answer the question by the primary team. The round will start with candidate A, and unanswered question will be passed to the next candidate in a manner that if candidate A is not able to answer, the question will be passed to the candidate B and then to the candidate C. Okay, so there are 4 options only. So the fourth candidate is not be participating in the for a question. 10 marks will be given to the primary candidate, 5 for the secondary, and 2 for the third. 2 participants will progress to the final round. Okay. So the first question starts with team A, and when we will have done with the question A, then we will move on to the question 2 with team B likewise. Okay. So the very first question for candidate A is Mental Health Care Act 2017 has dash sections and dash chapters. Let's see the answer. Anyone else want to answer this question, whether she is correct or not? So let's check the answer. The answer is correct. She has got 10 marks. Now move on to the candidate B with the question 2. prohibited procedures under MHCA are all except modified ECT for minors, psychosurgery, change in any manner or form.
Option B.
Anyone want to say anything? So candidate C has an option to answer this.
Option C.
Option C. Let's check the answer. Option C is correct. Team C has got 5 marks. So all A, B and D are the prohibited procedures, and not the psychosurgery. It is the sterilization of men or women when such sterilization is intended as a treatment for mental illness is prohibited procedure. Okay, again for candidate C, the question is, as per MHCA 2017, which one does not fall in the definition of mental health establishments? Mental health establishment under the definition under the Mental Health Care Act. The question is moving on to the candidate D. Answer is not correct.
City.
This is also not correct. Candidate A, we have left with the 2 options. This is quite a tough question.
So option B, application B.
You are also wrong. Nobody has got the answer. It is psychiatry OPD. Basically, what is there in the MHCA for mental health establishment is all the establishment which has a facility of accommodating a patient for treatment. So whether it's a general nursing home, psychiatric nursing home, rehabilitation center, an Ayurvedic hospital who are treating, giving treatment for mental illness, homeopathic hospitals, and any hospital under the roof of which the mentally ill patients are being treated is mental health establishment. And psychiatry OPD is kept out of the purview of this because to accommodate, to make the psychiatric practice more favorable for the society. So none of the psychiatrists should feel like restricting himself to give their services. The host chances, it's candidate D. Admission and treatment of persons with mental illness with high support needs in mental health establishment, which is also called as supported admissions, can be done for how many days under section 89 of MHCA?
30 days.
What should we do? What is opinion of seniors? Should we cancel or keep another extra question in the last? Extra question. So you should prepare that question. रह कैसे गया ये? वो यहाँ था. So this is the explanation. In the supported admission, there is a limit of period of 30 days, and if one wants to admit beyond the 30 days, there is a provision under the section 90. And if someone is not fulfilling the criteria of section 90, then it should be considered as admission under section 86. Now team A. How many units of alcohol make up a recognized weekly safe drinking limit as per the NICE guidelines?
Option B,
the right answer. So as per the NICE guideline, for both male and female, 14 is the safe limit. Now candidate B, Dr. Shyamashis. 60-year-old homeless has a history of alcohol dependence syndrome. In emergency, he is confused and agitated. He complains of double vision and he needs support while walking because of the disturbed gait. The most appropriate treatment is?
Option B.
Yes, it's right answer. Option B, because of high suspicion of Wernicke-Korsakoff syndrome. You have got the 10 marks. Candidate C. So this next cycle of questions are pertaining to substance abuse. The first cycle was of MHCA. 18-year-old presented in emergency department with acute anxiety. There is evidence of visual hallucinations, heightened color sensitivity, and derealization and depersonalization phenomena. He took a drug 6 hours ago and he initially felt relaxed, but anxiety has increased with the occurrence of described symptoms. Which drug he took?
Sir, independent.
Not the right answer. Candidate D.
Sir, LSD.
Yes, it's the right answer. You have got 5 marks. So moving on to the next question. The following are recommended and licensed nicotine replacement therapies except.
Electronic nicotine cigarettes.
It's the right answer. You have got 10 marks. Candidate A. Autonomic responses are typically associated with feelings of fear. These include increase in heart rate and blood pressure, which are regulated by reciprocal connections between the amygdala and the dash. Amygdala communicates with which part of the brain, which evokes the increased heart rate and increased blood pressure.
Option, option
Yes,
D. Locus therapeutic.
option D is right answer. Question for candidate B. So for explanation, the orbitofrontal cortex produce the feared affect in anxiety. The endocrinal response under HP axis is evoked by the hypothalamus. Parabrachial nucleus is the cause of increased respiratory rate in the anxiety, and locus coeruleus for autonomous, the heart rate and the blood pressure. Candidate B, Dr. Shyamashis. Alcohol-related damage to the dash can lead to memory deficits and other neurological complications.
Option A.
It's not the right answer.
SMC.
Again, not the right answer.
Prefrontal cortex.
Again, not the right answer. It's mammillary body. It is specifically implicated in the alcohol dependence. for memory deficits. So question for candidate C. Neurons of the dash basically acts as an on-off switch to the cerebral cortex and hence play a crucial role in maintaining arousal and consciousness. Basically, which pathway is responsible for consciousness and arousal? It's not the right answer. Candidate D.
Option B.
Option?
D.
Not the right answer. Candidate A.
So option B, reticular formation.
Yes, it's the right answer. You have got 2 marks. Reticular formation. Nigrostriatal pathways for it influence the voluntary movement through the basal ganglia motor loops, and ventral tegmental area is the part of the reward pathway. It is very known part of the brain, and we have discussed a lot of time the reward pathway and its ventral tegmental area is a part of it. And basal ganglia and nigrostriatal pathway acts in the conjunction to smooth function of voluntary muscles. Candidate D, Dr. Ria.
Either one finally.
It's the right answer. So we have left with the one question which was typed on the slide incorrectly, and hint was given in the slide. So we have came up with the new question for the candidate D, Dr. Ria. Decriminalization of attempt of suicide is done under which IPC? 307, 309, 306, 302. Under which section of IPC the attempt of suicide is decriminalized? It is not considered as a crime.
309.
This is the right answer. So give me a few seconds, so I will come up with the results. So finally we have got the results. Candidate A has scored marks 32, candidate B 10, candidate C 5, and candidate D 35. So the candidate A and candidate B is proceeding to the final rounds of this quiz session. Thank you. Thanks a lot.
Okay, let us move towards the third and the final round of today's quiz. Before moving forward, let us have a quick glance at the rules of today's quiz. A total of 5 questions are there. It's a buzzer round, so please pay attention. Whoever will be pressing the buzzer first will get the chance to answer first. So if answered correctly by the first responder, 5 marks will be awarded. If not, 3 marks will be deducted. So there is going to be a negative marking here. And the question will be passed on to the second participant. If the second participant answers correctly, 5 marks will be awarded, and wrong, then again 3 marks will be deducted. But second participant will have the choice to forego the question without any credit loss. There won't be any multiple choice question, and I won't be reading the questions out loud. You'll have to read and have to press the buzzer and answer.
Basically इसमें क्या है कि क्वेश्चन आएगा, you have to read out, ठीक है, and you have to press the buzzer, ठीक है. Who will press the buzzer first? They have to answer correctly. आपने buzzer दबाया, correct answer किया तो 5 marks. Buzzer दबाने के बाद गलत किया या नहीं किया तो -3 और क्वेश्चन चला जाएगा सेकंड
वाले. Ready? Chalo, let's move on. Anyone?
No time.
No time.
Okay, pause at that time. Now explanation.
Okay. Anyone from the audience?
Audience.
No?
Try now.
Okay, we'll move on to the answer. Answer is South London and Mossley NHS Foundation Trust. So Bethlehem Royal Hospital, also known as St. Mary's Bethlehem, Bethlehem Hospital and Bedlam, is a psychiatric hospital in Bromley, London. Its famous history has inspired many books, films, TV series, notably Bedlam, a 1946 film, and recently in 2012 a series of the same name. It is closely associated with King's College London and in partnership with the Institute of Psychiatry, Psychology, Neurosciences is a major center for psychiatric research. अगर आप लोगों को मैकनॉटन्स रूल याद होगा तो जो मैकनॉटन्स हैं उन कहते हैं कि उन्होंने वो भी इस हॉस्पिटल के इनमेट रह चुके हैं. So we have many prestigious inmates as well of this hospital. So moving on to next question.
इसके पास है आंसर.
Audience.
We had discussed in the case conference.
तो कैसे पर नेगेटिव मार्किंग हो जाएगा फिर अगर गलत चला जाएगा.
They're playing safe. So audience want to.
Audience.
Reply. Very correct. So let us move. CT scan. CT scan is the correct answer. So brain window and bone window are two modalities we see in CT scan. Whereas in brain windows, which are used to view a range of densities close to the average density of soft tissues of the brain. Usages, just come to the last paragraph. When examining CT scan with the brain window, radiologists focus on brain structures, including gray matter, white matter, CSF. So it helps to identify brain lesions, hemorrhage, and other neurological conditions. Whereas in bone windows, it is used to emphasize narrow range of densities close to density of bone. So we can see fractures, tumors, and other infections related to osseous structures. Alright, so we'll move on to third question now. So if you can see, brain parenchyma is visible in first one and osseous bone is visible in second one. Next. Okay.
It could be delusion or sensory delusion.
What?
What delusion?
What is the exact term?
Delusion of persecution.
Next, would you like to answer? So let us move to the. It's not.
You will get the answer. इसको पढ़ो ना.
अच्छे से पढ़ो.
She still insisted her freckles proved that she was being injected in her sleep. ठीक है. अब ऊपर आओ. X agreed that those sets of spots on her arms and on the arms of examiner are look similar. ठीक है, दोनों similar marks हैं. And accepted examiner's explanation of his own spots. ठीक है, उसके explanation को भी मान रही है. But she still insists on the basis of that mark and freckles that she is being injected. क्या हुआ, उसने कुछ देखा और फिर उसे एक परसेप्शन बना.
उसको स्टिमुलस है, उसने क्या बना
डिल्यूजन जो है ना, मतलब
आगे
कौन सा?
करेक्ट टर्म
कोई चीज देख करके कौन सा डिल्यूजन बनता है?
परसेप्शन
आगे आगे
ऑडियंस,
what is this term called? Yes, delusional percept. Come on. Delusional percept or delusional perceptions. So, delusional percept is a phenomena in which patient receives a normal perception that is then interpreted with a delusional meaning. Whereas in this question, she saw the freckles, but she gave it a different meaning and has an immense personal significance, which is of course false. And it comes under first rank symptoms of schizophrenia, which was given by Jasper. So most of the time it is difficult whether a delusion is truly a delusional percept or it is being used to explain the significance of certain objects of perception within a delusional environment. So we'll move on to next question. It's okay if you're getting it. Okay, just remember one thing, both the blanks have one answer. Same answer for both the blanks, which are marked in green.
alpha will be code for remote potential.
It once again. Next. So answer is P300. Okay, P300 wave is an event-related potential (ERP), which component elicited in the process of decision making. It is considered to be an endogenous potential as its occurrence links not to the physical attribution of the stimulus, but to person's reactions to it. More specifically, it is thought to reflect process involved in stimulus evaluation or categorization, and its presence, magnitude, topography decide which cognitive functioning is being hampered. So once the stimulus, external stimulation is given, this 300 is the millisecond, I suppose कि उतने टाइम बाद या तो पॉजिटिव रिस्पॉन्स आता है या नेगेटिव रिस्पॉन्स आता है. ओके, ठीक है. दिस रेंज जो ऊपर का रिस्पॉन्स पॉजिटिव है तो दैट इज P300. नेक्स्ट, last and final question. Pass.
No, if I answer now, I'll get negative also.
Yes, you can.
Pass.
She's scared of it. Anyone from the audience? So, yes, norepinephrine is the correct answer. So, when an opioid agonist binds to a mu receptor on non-adrenergic neurons in the locus ceruleus, relapse of norepinephrine is suppressed, resulting in sedation, hypotension, and a decreased respiratory rate, which recognized by signs of intoxication. So in this process, which is mediated by the downstream of cyclic AMP, in which opioid binding to the mu receptor result in decreased cyclic AMP and cyclic AMP dependent protein phosphorylation, which ultimately leads to decreased norepinephrine. And once the opposite starts, the increase of norepinephrine starts in withdrawal symptoms. So with this, we come to an end of today's quiz. I'll thank you all and thank you so much for participating, everyone. And we'll be back with the results, and I'll request sir to come.
We would be asking questions without options. As both they have answered a single wrong question, that is -3 the score is. So we would be going to ask a single question. Who would answer first would be the winner. 5 marks or 1 marks, anything you can consider for that, but would be the winner. As we have to decide someone has to be winner of the quiz. It's a buzzer round actually. Who would buzzer and answer first actually? Yeah. So we have asked that IPC 309 falls under which section of MHCA and which chapter of MHCA?
I will give you a simple question. You can ask, you have read tricyclic antidepressant, and which tricyclic antidepressant has a maximum serotonergic effect, which is also used in, you can guess.
In clozapine monitoring, we check ANC. Which other blood parameter we check?
Fasting glucose.
That is checked in many, na? Just ANC count, absolute neutrophil count. With other absolute count, we would check. Yes. The winner is Dr. Surbhi.
ये मेरा पहला क्विज था। इस क्विज से मतलब सारे भी फैकल्टी भी जितने हैं, जितने भी पीजी हैं, उनसे काफ़ी कुछ सीखने को मिला और इंटरेक्शन बना, और आगे भी मैं चाहता हूँ कि ये क्विज होता रहे।
I would like to thank everybody present here for this wonderful opportunity, and I would like to thank also for the fact that I also had a little bit of nervousness in the starting. I think these kind of things will help us in creating some kind of self-confidence as well. So thanks for the opportunity.
And I would like to thank the Institute and family to pick up such a big issue, and my JR3s for being so supportive, and to the LLR colleagues also, and looking forward to interacting more with you people, and thank you very much.
किसी के मन में ये संशय ना रहे कि क्वेश्चन पेपर अगर हमने बनाया तो हमने शायद क्वेश्चन पेपर नहीं किया, ऐसा बिल्कुल भी नहीं था। I had informed my department regarding this quiz competition, and nobody knows what is going on. On the very last day, that is today only, I had disclosed that how we will proceed to my SR and to my GRK, because the faculties are not available today, so I had taken the help of GR3s. So question paper was very secretive. It it was with me till today, and I disclosed it to other managers today evening only, and they got to know these things. So the answers were not disclosed beforehand, and it was very secretive, and the sessions were fairly was conducted by this means. तो क्वेश्चंस का किसी को नहीं पता था, आंसर्स का किसी को नहीं पता था. तो हमने पहले भी क्विज किया है अपने कॉलेज में, इंटर डिपार्टमेंटल क्विज किया था. तो वी हैड रिमूव्ड बायस by the virtue of we did not include our resident in that quiz, psychiatric quiz. We included the participants from other departments like medicine, anesthesia and all, and all the residents were volunteered to conduct that quiz. So bias was removed. So bias was removed for today also. So it was a very good session. मैं ये कह सकता हूँ कि जो सेकंड राउंड और थर्ड राउंड है, it was very tough round for it may be tough round for faculties also. तो क्वेश्चन पेपर किसी और ने बनाया होता तो शायद मेरे लिए भी मुश्किल होता है ना, लेकिन वो एस्पेक्ट जो है ना वो करना था. तो फाइनल राउंड में एक खास बात है कि 5 क्वेश्चंस वर बेस्ड ऑन 5 एस्पेक्ट्स ऑफ साइकियाट्री. जो फर्स्ट क्वेश्चन आपने देखा कि इट वाज बेस्ड ऑन हिस्ट्री. सेकंड क्वेश्चन था somewhat on 4 window brain imaging based question, एक साइकोपैथोलॉजी बेस्ड क्वेश्चन था, एंड एक शायद E300 जो हमारा न्यूरोबायोलॉजी बेस्ड हो गया. तो वो डिफरेंट एस्पेक्ट्स थे, ट्रीटमेंट रिलेटेड भी था. इस तरह से वो डिवाइड किए हुए थे कि हर एरिया से वो क्वेश्चन लिए गए. ऑलमोस्ट सेशन काफ़ी अच्छा रहा, इंटरेक्टिव रहा, और सबसे अच्छी बात है कि हम दोनों डिपार्टमेंट आपस में मिल रहे हैं, कम्युनिकेट कर रहे हैं. आगे भी हम आपस में कम्युनिकेट करते रहेंगे, एक दूसरे से सीखते रहेंगे, है ना. कुछ अच्छी बातें किसी डिपार्टमेंट में होती हैं, कुछ अच्छी बातें किसी में होती हैं. तो मैंने